3 years ago, a 54-year-old man walked into my clinic for a routine checkup. Totally fine. Blood pressure a little high, nothing crazy. 2 weeks later, he was in a hardware store and his chest felt like someone parked a truck on it. Here's the part that matters. He didn't panic. He didn't Google it. He didn't wait to see if it would pass. He did 3 specific things in the next 4 minutes that his cardiologist later told him were the reason he's alive to tell me about it today. I'm going to give you those exact 3 things. Not vague advice like eat healthy, actual specific actions you can take in the middle of an emergency in order starting right now. Stay until the end, because technique number 3 is the one almost nobody knows, and it's the one that actually saved him. Quick context so you know why you should care what I'm about to say. I've spent years around cardiac patients, pre-event, mid-event, and post-event. I've seen the full range. People who did everything right and walked out of the hospital in 4 days, and people who did everything wrong and didn't walk out at all. The difference, more often than you'd think, isn't the severity of the heart attack. It's what happened in the first 5 to 10 minutes. That's the part nobody teaches you. You get CPR training maybe once at work years ago, and you forget it by lunch. You've never once rehearsed what you'd actually do if it was you in your kitchen at 11 p.m. with chest pain that won't quit. So today, no fluff, no 20-minute build-up about the silent killer. Just the 3 techniques, why they work, and exactly how to use them. Because a heart attack does not wait for you to feel ready. Let's talk about why this actually matters, because I think most people have a dangerously wrong picture of what a heart attack looks like. You've seen the movies, guy grabs his chest, gasps dramatically, collapses. That's not how it usually goes. Most heart attacks start quiet, a pressure, a tightness, some nausea. Maybe your left arm feels a little heavy or your jaw aches and you think you slept on it wrong. Women in particular often get fatigue, shortness of breath, or upper back discomfort with none of the classic elephant on the chest feeling at all. And because it doesn't look like the movie, people talk themselves out of it. It's probably just heartburn. I'll see how I feel in an hour. I don't want to bother anyone. That hour is the single most dangerous decision most people make in their entire life, and they don't even know they're making it. Here's the brutal math behind that decision. When a coronary artery gets blocked, the heart muscle downstream of that blockage starts dying from lack of oxygen, not eventually, immediately. The damage is progressive, and it is largely irreversible. The muscle that's dead at hour 3 is dead forever. It doesn't grow back. So every single minute between the first symptom and getting treatment is muscle you're trading away permanently for the comfort of not overreacting. And the scariest part isn't even the heart attack itself. It's that a heart attack can trigger a completely different, more immediate emergency, cardiac arrest, where the heart's electrical system goes chaotic and it stops pumping blood altogether. That can happen in the first hour, often before anyone's even called for help. That's the moment where the clock isn't measured in get to a hospital eventually. It's measured in seconds. This is why wait and see is the most dangerous phrase in cardiology. Nobody plans to die of embarrassment, but that's functionally what happens when people downplay symptoms because they don't want to seem dramatic. So here's the reframe I want you to walk away with before we even get to the techniques. You are not overreacting. You are pattern matching against a system that is trying to kill you quietly and politely. Treat it like the emergency it is every single time, even if it turns out to be nothing. I would rather you feel silly in an ER waiting room than have your family visit you in a different kind of room. Now let's get into what actually works. Before technique 1, I want to give you a single sentence, not a technique, a mental trigger. When something feels off in your chest, ask yourself this exact question. Would I be doing this same thing right now if I already knew this was a heart attack? If the honest answer is no, if you wouldn't keep driving, keep working, keep waiting it out if you knew for certain, then you already know what to do. You just haven't let yourself admit it yet. That one question strips away all the excuses your brain generates in real time to avoid feeling dramatic. Hold on to that question. We're about to build the 3 techniques directly on top of it. This is the technique that gets skipped more than any other, and it's the one that matters most. Here's the mistake almost everyone makes. They treat calling emergency services as the last resort. Something you do after you've tried resting, after you've taken an antacid, after you've told your spouse, if it's not better in 20 minutes, I'll call someone. That order is backwards, and it's backwards in a way that costs lives. Calling emergency services needs to be the first move, not the last one. Not after you drive yourself to urgent care, not after you lie down for a bit to see if it passes. First, Here's why this specific order matters so much, and it's something most people never think about. An ambulance is not just a taxi with a siren. It is a fully equipped mobile treatment unit. The moment paramedics arrive, they can start reading your heart's electrical activity, they can administer oxygen, they can start treatment before you've even reached a hospital door. If you drive yourself instead, you get none of that, and you're now driving a vehicle while potentially seconds away from losing consciousness. People have caused fatal accidents driving themselves to the hospital during a heart attack. Don't be a statistic that takes someone else down with you. There's a second reason this matters that almost nobody talks about. If your heart goes into a dangerous rhythm, the cardiac arrest scenario I mentioned earlier, the outcome depends entirely on how fast someone can start CPR and get a defibrillator on you. If you're already in an ambulance or paramedics are already in your living room, that response time is seconds. If you're alone in your car on the highway, it's the difference between life and permanent brain damage if you survive at all. My patient, and the guy from the hardware store, didn't try to power through it. He didn't finish his shopping trip. He felt the pressure spread into his jaw, remembered that gut check question, and called for help immediately before he'd even left the store. He told me later the hardest part wasn't the pain. It was overriding the voice in his head telling him he was overreacting in front of strangers. Here's your action step. The second something feels genuinely wrong in your chest, not "I'm 100% sure," just genuinely wrong, you call. You don't wait for confirmation. You don't wait for it to get worse. You call, then you deal with the "was I overreacting" conversation later, ideally from a hospital bed where you're fine, instead of not having that conversation at all. I already know what some of you are thinking because I hear it constantly in the clinic. But what if it's nothing? What if I call for an emergency and it turns out to be indigestion? Won't I feel embarrassed? Won't I be wasting resources? Let me kill that thought completely, right now. Every single emergency dispatcher and every ER doctor I have ever spoken to would rather see 100 people come in with heartburn than have one person stay home with a heart attack because they didn't want to waste anyone's time. That is the entire job. That is what the system exists for. You are not a burden for using it correctly. Embarrassment has never once been listed as a cause of death on a certificate. Untreated heart attacks are listed constantly. Choose which list you're worried about. All right, technique 2. While you're waiting for help to arrive, and this only takes minutes, but minutes matter enormously here, there's a second action that can meaningfully change the outcome, assuming there's no reason you personally shouldn't take it. If you have adult aspirin available, and you have no known allergy to it, and no condition your doctor has specifically told you makes aspirin dangerous for you, chewing a standard aspirin tablet while you wait for emergency services can help. The reason this matters is about mechanism, not superstition. Most heart attacks are caused by a blood clot forming on top of a ruptured plaque inside a coronary artery. Aspirin interferes with the clotting process, and it can help slow the clot from growing larger while you wait for definitive treatment. The chew it, don't swallow it whole part isn't a random detail. It's the whole point. Chewing breaks the tablet down so it starts absorbing through the tissue in your mouth almost immediately, rather than sitting in your stomach for 20 or 30 minutes before it starts working. In a situation where every minute is muscle tissue, that difference in absorption speed is exactly the kind of small decision that adds up. A few important honesty points here because I'm not going to oversell this. Aspirin is not a cure. It doesn't open a blocked artery. It doesn't replace calling for help. It's something you do while you're waiting for help, not instead of it. If you're already on blood thinners prescribed by a doctor, or you have a known bleeding disorder, or you've had a reaction to aspirin before, this isn't the moment to experiment. This is exactly the kind of detail worth mentioning to the 911 or emergency dispatcher on the phone and letting them guide you because they can tailor that advice to your specific situation in real time. That's actually an underused resource, by the way. The dispatcher on the phone isn't just taking your address. Many are trained to walk you through exactly this kind of decision while help is en route. Use them. Answer their questions instead of rushing them off the phone. They're not slowing you down. They're actively treating you before anyone arrives. My patient did exactly this. Store employee got him a tablet from the first aid kit while they waited outside for the ambulance. Small action, 30 seconds. And it's one of the specific things his cardiologist highlighted afterward as having likely limited the extent of the damage. Quick pattern interrupt, because there's a detail here that gets completely ignored in almost every heart attack advice video I've ever seen. What position your body is in while you wait. Don't keep standing. Don't keep pacing around because you're anxious. Sit down, or better, sit half reclined with your knees slightly bent. Think propped up in a chair, not flat on your back. This position reduces the workload on your heart compared to standing or lying completely flat, and it makes it easier to breathe if things get worse. If you have any tight clothing, a tie, a belt, a restrictive collar, loosen it. None of this fixes the underlying blockage, but it takes unnecessary strain off a heart that is already struggling, and it costs you nothing to do. Now, the technique almost nobody knows. This is the one I promised you at the start. Here's the technique that gets left out of almost every list like this. And it's the one that, in my patient's specific case, was the actual difference maker. Do not go through this alone, and do not let yourself become unreachable. Here's what that means in practice. The instant you suspect something's wrong, in addition to calling emergency services, get another human being physically near you or on the phone with you if at all possible. A coworker, a stranger nearby, a family member, anyone. Unlock your front door. If you're home alone, prop the door open or unlock it before you sit down so paramedics don't lose critical minutes because they can't get inside. If you're in a store, a workplace, a parking lot, tell someone near you what's happening. In plain words, I think I'm having a heart attack. I've called for help. Please stay with me. This sounds almost too simple to be called a technique, but here's why it's genuinely one of the most important actions you can take, medically speaking. If your heart goes into that dangerous rhythm I mentioned earlier, cardiac arrest, you will likely lose consciousness within seconds, with no warning. If you are alone, behind a locked door, with your phone out of reach, nobody is starting CPR on you, and nobody is unlocking that door for paramedics. The single biggest predictor of surviving cardiac arrest outside a hospital is how fast someone starts chest compressions and gets a defibrillator on you. If there's no one there, that number goes to 0, no matter how fast the ambulance is driving. This is exactly what happened with my patient. He didn't just call for help and sit in a quiet corner of the store to wait it out privately, which is what most people instinctively do. There's a strong pull toward wanting to manage this quietly, not make a scene. He did the opposite. He flagged down an employee immediately and said plainly, I think I'm having a heart attack. I need you to stay with me and let the paramedics in. That employee stayed with him the entire time, kept him calm, and was standing right there, phone in hand, when his condition briefly worsened before paramedics arrived, because someone was present and informed there was no delay, no confusion, no locked door, no missed window. If you are ever in the position of being the other person, someone tells you they think they're having a heart attack, your job is simple. Stay with them, make sure emergency services have actually been called, keep the entrance clear for paramedics, and if they lose consciousness and stop breathing normally, start CPR immediately and keep going until help arrives or the person starts breathing on their own. If a defibrillator is nearby, many public spaces have one mounted on a wall. Get it and follow its voice instructions. They're built to walk anyone through it, no training required. Every minute of delay in starting compressions measurably lowers the odds of a good outcome. And even imperfect CPR started immediately beats perfect CPR started 2 minutes late. So, technique 3. In one sentence, isolation is the actual killer as often as the blockage is. Get people around you, get doors unlocked, get your location known before things have a chance to get worse. Let's stack all 3 so you have the actual sequence in your head, because in a real moment, you won't have time to think. You'll just need to act on something you already rehearsed. 1. The second something feels genuinely wrong, call emergency services first, before anything else, before driving, before waiting it out. 2. While you wait, if it's safe for you personally, chew an aspirin and tell the dispatcher exactly what you're feeling so they can guide you in real time. 3. Get another person near you or on the phone, unlock your door, sit in a half-reclined position, and stay put until help physically arrives. That's it. That's the whole sequence. No fluff, no 20 extra steps to memorize under pressure. 3 moves in order that took my patient from guy having chest pain in a hardware store to guy who was walking laps around the cardiac ward 5 days later. One honest caveat before we close, because I take this seriously. Nothing in this video replaces professional medical training, and I'm not diagnosing you or anyone watching this. Every person's situation is different, and things like medication allergies, existing conditions, and specific circumstances all change what's appropriate for you individually. If you want to be genuinely prepared instead of just informed, go get certified in CPR and basic first aid. It's a few hours, it's inexpensive, and it is one of the highest leverage things you can do with an afternoon of your life. You are far more likely to use it on someone you love than a stranger. If this video changes what you do in the first 5 minutes of an emergency, for yourself or for someone standing next to you, it did its job. but information you don't act on doesn't save anyone. So here's what I want you to actually do right now, not later. Send this video to one person, your parent, your partner, your coworker, whoever is most likely to be near you if something like this ever happens. Not because you're worried about them specifically, much because you want them to know these 3 moves if it's ever you. Subscribe if you want more of this real, specific, no fluff information from someone who's actually stood in these rooms, not just read about them. And drop a comment below. Have you ever been in a moment like this or known someone who has? I read everyone, and honestly, those stories are what keep me making these videos. Stay safe. Take chest pains seriously, and I'll see you in the next one.